Good afternoon, and again, deepest appreciation to the AIS co-chairs. Privileged to participate, and also congratulations on a thought-provoking agenda. And I certainly hope that this topic does it justice. So, my name is Caro van Hove. I am the CEO of Revelle Aesthetics. We are a VC-backed company that has launched a device called Healthegy, which was born out of a Stanford-based medtech incubator and uniquely designed to treat cellulite, which is one of the most prevalent, one of the most bothersome issues affecting 90% of women below the belt. So why care about cellulite, and why should we be directing our attention below the face, where, let's face it, all innovation has happened in the last 20 years? And it is because, as all these data points here suggests, women's concerns related to their bodies, ranging from cellulite to laxity to overall body shaping, are becoming the fastest growing areas, both in terms of solutions, but also a demand for solutions. And that makes body truly the next frontier in medical aesthetics. And a case in point is, I think the Society reported just earlier this year, liposuction has now become the #1 body procedure performed by plastic surgeons. And I would say that's only logical, considering the abundance we now have of well-established treatment options, but also the growing normalization of facial rejuvenation. And as a result, women are now just simply descending their wishes for rejuvenation far below the neck. Let's see if I can work it. There we go. So let's talk about body. Still very much an emerging, but a heavily discussed topic already amongst media and women, as you can see here, but it begs more questions than answers. And that is due to the complex anatomical interplay of issues of the body, as well as, very candidly, due to the fact that there have been very few validated and very few reliable treatment for body to date. So why is the body so complicated to solve for? Well, not too dissimilar from the face, it is multifaceted, with the majority of us women presenting with more than one issue at a time. So let's study the illustration of this woman here. And so first and foremost, while this body type is not necessarily the body type that we see in advertising today, she is not too uncommon. And she's not too uncommon because while the face actually ages in a similar pattern, so affected by years and genes and hormones, the body is obviously a larger surface, so the signs of aging will be far more pronounced much faster. But, so again, not an unusual profile, you just don't see it every day because we women don't expose our bodies the same way we do our faces. So, but what are the primary body concerns that we can observe here, and how are they being addressed today? First, most of us women start to experience volume loss in that upper pole region. Often that's paired with breast ptosis. Pretty well-established procedure for that today is a breast augmentation with an implant, a breast lift, fat grafting. There's a lot of innovation happening in this area that you're going to hear about from Denise from the Sientra team. Then we descend kind of our direction down to the midriff. What do we see? We women during pregnancy, after pregnancy, we have separation of the abdominal muscles. Oftentimes that's also the area that's very prone to accumulation of fatty tissue, sadly also paired with laxity. So what is being done about that today? Diastasis recti repairs are becoming very popular. Generally always part of a tummy tuck or abdominoplasty. So we've got liposuction part of that, skin tightening, some very cool modalities as of late with, for example, Renuvion or skin tightening techniques. But what about below the panty line? What about below the waist? So what do we see here? First, we women start to experience some volume loss in that hip dell region. Also, the upper lower extremities is where we generally tend to gain quite a bit of fat, makes our trunks a little heavier. And then, as was mentioned, it's also where gravity really starts to show up and really presented by quite a bit of laxity in that inner and outer thigh area. And then 90% of us women also have cellulite in that thigh and in that buttock region. Now, because innovation and technique refinements have been so focused these last few decades on the face and sort of these two upper thirds of the body, it really is still an enigma on how to treat this cluster of issues in the lower extremities, even though, and I will say it, this area is the most handicapping to us women. It affects what we wear, it affects how we work out, and it also affects our comfort level with intimacy. But the good news is, there's some progress being made. So let's start to unpack these multiple layers of complexity of lower body issues and what exactly are lower body issues. The broad consensus amongst physicians is that lower body issues can be defined as three very separate things. First is the issue of cellulite. So cellulite, to be defined as any irregularity on the surface of the skin that is caused by these fibrous bands that essentially they stiffen, they shorten, and they pull down that skin and they put tension on it. And that causes these divots or depressions on sort of the buttock and the thigh region. Then there's the issue of fat, which is different, either too little or too much. We lose it in areas that's undesired, affecting our overall booty shape, and then we gain it in other areas that are unwanted, and it gives us this disproportionate look. And then there's the issue of laxity, which is separate from cellulite, separate from fat, but it's that loose or drapey skin, if you will, not necessarily age-related. It can be genetic or hormonal too. But it's very important when we're talking about lower body that we really start to look at these issues holistically, but really diagnose them separately. Because when you look at them, each and every one of those issues is not complicated, but the complexity comes in because most of us women essentially have all three at one time. And so there are a few treatment options that currently try to pursue each and every one of these concerns, as you can see here, but not always reliably and also not always with full patient satisfaction. So the big question becomes, which of these treatment options should really be paired together to start solving truly effectively for lower body rejuvenation? So then turning to Revelle, we've spent the last few years solving for the cellulite portion of the equation, which is the biggest detractor to women's confidence in the lower body. So we spent quite a few years really studying the underlying anatomy of cellulite, which, as the literature will show, is multifactorial. So you've got a thinning dermis, you've got fat lobules, fat cells that become larger, and then you have these fibrous bands, these septa. They attach skin to muscle layer, and they stiffen and shorten, and really, as I said, they pull down that skin. It's also well documented in the literature that of all those factors, it's the septa that are essentially the biggest contributor to that overall appearance of cellulite. But what we also found is that it's those exact septa that are actually the most misunderstood. And that in fact, they are never these simple singular bands that are right underneath a dimple or a depression. So instead what we saw is that these septa that cause those dimples are these complicated webs, these complicated structures of multiple fibrous septa, almost like a 3D honeycomb structures, if you will, and they also vary from region to region. So a cluster of septa that causes a dimple in a buttock region is different in a thigh. And so with that anatomical knowledge in mind, we essentially have created a precision instrument that gives the provider underneath the skin a tactile feel to first identify where is that complex culprit structure of septa that tethers the skin, then allows that provider to release it in a very precise and a controlled manner, but then most importantly, allow for a verification of that release of that entire culprit of septa. So that makes Healthegy truly a one-time treatment. That means we can treat 5 to 50 depressions all in one go in the buttock as well as in the thigh region, and also varying degrees of depth. This is not capital equipment. We are a single disposable. It's done under local anesthesia. The good thing is we only need one pair of hands that are trained and skilled, and our since launch uptake has been rapid both as a standalone as well as an adjunct to other body procedures in the OR. So today our mission is truly to set a new standard for treating cellulite, as you can see here from a few examples from our one-year pivotal study. And essentially our opportunity here is to deliver providers with visible and reproducible results for women who are very, very bothered by cellulite. But I would say almost more meaningful than just smooth bare bottoms and legs are the confidence boost that we can now give to women by enabling them to wear these very popular tight light color clothing that no longer show these skin imperfections, as you can see here from some of Dr. Harrington's cases. But I want to go back to something that I've said earlier, which is lower body rejuvenation is a sum of different parts, which means we have to all do better than just solving for the cellulite, just solving for the laxity, or just solving for the fat. Because don't get me wrong, of course, we're extremely pleased now that with a single treatment, we can visibly and reliably reduce that cellulite. Again, these are two of Dr. Harrington's cases. But if you look at the highlighted areas, which are the depressions that were targeted, and you look at the post-op, I think we can all agree it's a nice resolution, if not a full resolution. But as the wise Aristotle once said, the whole is always greater than the sum of its parts. So what I mean with that is that by pairing Healthegy for the reduction of cellulite with other modalities that also treat the laxity and that also tackle the fat, we can just do better for her. And that's beautifully illustrated by a case by Dr. Stark in Philadelphia. He essentially treated this patient with liposuction to the flanks, liposuction to the inner thigh. He then added an Avali treatment for those deep dimples in her buttock that were bothersome to her. And then he layered on some Body Tight to start addressing those early signs of laxity in that lateral buttock region. And if you compare these two, of a single treatment approach versus a multimodality approach, similar to a mommy makeover, similar to facial rejuvenation packages, I think it's a rhetorical question for most of us women as to which approach would make us happier. So essentially, a comprehensive approach to lower body rejuvenation, as beautifully stated here by Dr. Amalfi, it should just be a focus for all of us, by really pairing our different tools together, but I would also say by discontinuing this false notion that one treatment solves for all. And so with that, what is the opportunity with lower body rejuvenation? I would say it's exponential. First, it just means market growth. Like I said, like you're promoting mommy makeovers, like you're promoting facial rejuvenation packages, if we start to promote to women that there are now combination packages for smoother and better shaped booties and legs, it will draw more women in. Secondly, also, lower body rejuvenation will always be a multimodality play, which means it will be inclusive of non-invasive to minimally invasive to invasive options. And so that lends an opportunity for different skill sets to get involved. And Avali is a good example of that, because here you see some of the great surgeons that are avid users of the Avali treatment, but also their extenders who are high volume users of Avali. Very importantly also, lower body rejuvenation presents product partnership opportunities for us, because today we put resources, money, dollars into really supporting the promotion of a single product in a practice. But what if we pooled those resources together to help a practice promote their full body offering? Much more advantageous to them, much more advantageous to women, and we can still do that by adhering to our own product indications. And then I would say above all else, lower body rejuvenation and really cracking that code will just simply elevate patient satisfaction. This is a case from Dr. Casas in Chicago. This patient was treated 2 years ago with L-therapy and a dilute filler. This is her baseline 2 years after. She then wanted to take it a step further and treat the cellulite. And I think if we look at that picture here, as well as her lateral left and her lateral right thigh, where the same Avali procedure was applied, I think we can all safely say that's an extremely satisfied woman. And then last but certainly not least, I would say in a market that is so at risk of commoditization, viewing the body as a whole will just also differentiate outcomes for providers. So in this case, this surgeon's eye didn't stop at the waistline, so he combined a 360 lipo with an Avali procedure to really smooth out that entire backside. And I would say that's definitely a step up in a result for him, but also a step up in confidence for her. So with that, I hope this was insightful, and now I look forward to learning all about these different treatment modalities for lower body and then having a very rich discussion on how they should be paired together to really crack the code on beauty below the belt. Thank you.